Carrie Milton, and my topic is why you shouldn't take prescription drugs extensively. This is my audience. When people are asked what they think the leading cause of death is, most people would say gunshot or car accident. Tom McClellan, the co-founder of the Treatment Research Institute, says that they would never imagine that it's actually pharmaceutical opiates, which are painkillers. Someone dies from an accidental overdose every 19 minutes. Whether it be a painkiller, antibiotic, or something else, everyone has been to the doctor and been prescribed a prescription drug at some point in their life. There is literally a drug for just about anything. My mom is on 14 different prescription drugs that she takes on a daily basis. Every time she has a health concern, she goes to the doctor and they prescribe her with another drug, instead of looking into the problem more. My mom just listens to the doctors and does what they tell her. They prescribed her Klonopin, which is actually used to prevent and control seizures and panic attacks. She was prescribed this to help her sleep at night. She was taking it for a while and ran out of her prescription and missed the dose for 2 days. I got the prescription for her and brought it to her, and whenever I got there, she was experiencing withdrawals. She was shaking and borderline convulsing, and it was one of the scariest things I ever had to witness, especially it being my mother. She did not know that she had become so dependent on the drug and did not know that if she missed a dose or two, that something like this would happen. My mom has been on prescription drugs for many, many years, and it seems that instead of her health getting better, her health is just getting worse, and she is just being prescribed more and more medications. So today, I'm going to talk to you about why you should not take prescription drugs over a long period of time. I'm going to go over 3 most commonly prescribed drugs and their side effects. I will talk about Ritalin, Xanax, and Loratab. Many people are prescribed these common drugs every day, but the side effects of taking them over long periods of time can be very serious. But some drugs are meant to be taken for a long period of time. For example, Ritalin. Ritalin is used to treat ADD and ADHD in children and teenagers. This is prescribed to be taken over long periods of time of their life to help them focus. According to an article on drugfreeworld.com, taking Ritalin for a long time can decrease the blood flow to your brain. This can cause high blood pressure, which can lead to heart attacks, strokes, and even death. It can cause liver, kidney, and lung damage. Psychosis and malnutrition are short-term effects as well as long-term effects in Ritalin users. Also, taking Ritalin for a long period of time can increase the rates of depression and anxiety. Anxiety is very common. A common drug used to treat this is Xanax. Xanax is used to treat anxiety and panic disorders and anxiety caused by depression. According to an article on the AARP website, Xanax can produce powerful hangovers, especially in older adults. It can also cause memory loss, dementia, and even suicidal thoughts. Ironically, long-term use of Xanax can actually worsen or cause anxiety. Xanax is not intended for long-term use and should actually only be taken no more than 30 days at a time. Loratab is another prescribed drug that is not intended for long-term use. Loratab is a pain reliever and is used to treat coughs. It contains hydrocodone, which is a narcotic similar to codeine and heroin. According to an article on drugabuse.com, you can become addicted to Loratab even when taking as prescribed by your doctor. Long-term use of Loratab can cause hearing loss and severe liver damage. Tolerance is a big deal with Loratab. Tolerance means that you get used to a certain dose, which means you have to take a higher dose to get the same effect you did with a lower dose, and so on and so forth. And this can easily lead to addiction. Addiction is common with all of these drugs and can happen to anyone. Prescription drugs can be very helpful to relieve pain, anxiety, depression, and so on. Some people might oppose to not taking prescription drugs for long periods of time because some people need them to live a normal life. This does not mean that they will not experience serious, sometimes fatal, long-term side effects of these drugs. If you or someone you know are experiencing the side effects from drugs, please visit your doctor immediately. Also, if you or someone you know may have an addiction to a prescription drug, you can call the National Alcohol and Substance Abuse Information Center at any time, toll-free, at 1-800-784-6888. 6776 or go to their website and they will help to recommend the best and safest local drug and rehab centers for you or your loved one. Thank you.